A very good morning, everybody. Your Excellencies, distinguished guests, honored guests, ladies and gentlemen, welcome to ISIS Forum. Today, our discussion will be focusing on fighting the inequality pandemic, which comes from the COVID-19, and we will also be looking at its economic impacts on marginalized worker groups specifically. Before we start, let me go through some basic guidelines of the webinar. There will be no Chatham House rules, so attribution to comments can be made during the presentations. The discussants will have around 20 minutes to present their findings. And I, as the moderator, will intervene when necessary, when the time is almost up. The Q&A session will actually be conducted through the raised hand function and also through the Q&A boxes. My colleague Haris Zaino will be assisting me with the Q&A session. So again, please feel free to ask questions at the end of all of the presentations. So ladies and gentlemen, a year into our lockdown, we see the devastating impacts of the pandemic to our economy, our households, and the vulnerable groups that include youth and women specifically. With 6 different packages, stimulus packages already being introduced, an important question would be to explore how effective these packages are in mitigating the negative impacts of the pandemic on our labor force. This webinar will explore all of these negative impacts and highlight what policymakers can do in minimizing inequalities while building Malaysia's resilience in the long run. Today, we're joined by 4 speakers who I will introduce later on. Today, to kick off our session, let me invite our Chief Executive, Mr. Harizal Hazri, to give his opening remarks. The floor is yours, sir.
Thank you, Juwita. Selamat pagi, good morning, Excellencies, distinguished speakers, honored guests, ladies and gentlemen. I am totally delighted to welcome everyone at today's ISIS Forum, which is titled Fighting the Inequality Pandemic, COVID-19 and its impacts, its economic impacts on marginalized workers groups. Now, I think this is very interesting because, again, with the backdrop of the pandemic, COVID-19, we are discussing one of the most important things of modern economy, or the important issues of modern economy, which is inequality in itself. I think what the pandemic has done, ladies and gentlemen, is it has actually shown the fault lines of our economic system, and it has exacerbated instances of inequality in many different groups within the society. And obviously, inequality, as the term itself suggests, is never the same. Certain groups are less impacted and other groups are more infected. And unfortunately, we have seen that the lower income group has been infected more due to COVID-19 pandemic. Ladies and gentlemen, the question of inequality is actually, we have discussed about this, we have spoken about this, books have written about this for many, many years. I still remember when I was a first-year student at the Faculty of Economics, for every young activist, the term inequality would first come to their mind. And this is something that we have been trying to address. So instead of saying, instead of titling today's webinar as the inequality pandemic, I would actually think larger. And I hope this discussion would also lead to that, which we are actually talking about the pandemic of inequality itself. It has been a pandemic the economic system has tried very much different governments, different countries, but to a large extent, we have indeed failed to address the real causes and what we can do to basically elevate the situations of marginalized groups and get them out of the pandemic of inequality. Again, COVID-19 has basically exacerbated this problem. And today we are going to be discussing, focusing on that. I hope that this is going to be a fruitful session. I hope that we are able to basically look at this not just during the times of the pandemic, but we will continue to strive to address these issues, and hopefully one day we can find a better solution moving forward. With that, I invite everyone again to join the webinar. I congratulate all of our speakers for their excellent work and the ideas they have moving forward in this particular space. Back to you, Juita.
Thank you, sir. And now on with the show. Our first speaker is Mr. Kelvin Chang, who is an analyst at the Economics, Trade and Regional Integration Division here at ISIS. His primary research interests include economic growth and development, trade, and social assistance focuses. Today, he will be presenting his findings on the overview of the impact of the COVID-19 pandemic on the labor force as a whole in Malaysia. The floor is yours, Kelvin.
Thank you, Juita. Let me share my screen. Okay. Full screen. Okay. So, Salam Sejahtera and good morning, friends and colleagues, and a sincere thank you for taking the time to listen to me and our other really excellent speakers here today. So today I'll be presenting updated and extended research from my October 2019 policy brief titled Push to the Margins, the Unequal Impacts of the COVID-19 Pandemic on Malaysian Workers. So if you're interested, please do read the original report via the link on this page as well. And of course, my slides will be available for download after this as well. So today, my presentation will look at how the COVID-19 pandemic has worsened economic disparities, and specifically how marginalized worker groups like women, youth, and the less educated workers have suffered far larger impacts than the average worker, whilst also being left out of the recovery that has followed. And so today we'll look first at the overall picture of the labor market before we dive into sort of how different worker groups are faring, and then I'll briefly also talk about some policy solutions. So my presentation is sort of a background and sort of set the stage, and then after that, the following speakers hopefully will go into greater detail on some of the specifics. And yeah, so first, looking at the overall state of the labor market, right? And the headline national unemployment rate, which is this chart, isn't looking so great, right? So 1 year after the initial onset of COVID-19, the unemployment rate is still close to the highest it has ever been in nearly 40 years or something. It's sitting at currently 4.9% in January 2021. And of course, this is a partial recovery from the May 2020 peak of about 5.3%. It's really not by much, right? And recent data in January 2021 suggests that it has started to sort of inch upwards again. And to give you a sense of how high this is, how high it is now, in 2009, during the height of the global financial crisis, the unemployment rate back then was 3.7%, and that's far lower than the levels we are at today, right? So we know that unemployment is high, and in fact that there were about 761,000 unemployed Malaysians at the end of last year, and that's over 250,000, 250,000 more unemployed persons compared to a 2019 average. And worse, now we're looking on the right. Besides that spike in unemployment, about another 250,000 Malaysian workers have been driven to exit the labor force entirely, right? So this means that these additional 250,000 people are not only are they unemployed, right? They're not even trying to look for a job. They've completely exited the labor market, and they're either doing unpaid family care work, or they're discouraged, or they're going back to school, or they're retired. So two things we'll look at throughout the remainder of this presentation is to sort of assess the impacts is first, how much is employment decline, right? And the second thing is how much the labor force, how much has it shrunk? And that also talks to about the sort of labor market exits, right? And when we start to look beyond these headline aggregate numbers, we'll start to notice that for many worker groups, specifically in this presentation focusing on women, younger workers, and less educated or lower skilled workers, the impacts of the pandemic are far, far worse than just the aggregate numbers that we've seen in the previous slides. So first thing, let's look at the gender dimension. And this chart shows the change in employment by gender year on year across all 4 quarters of 2020, with the darker blue line sort of representing the female workers and the lighter blue line representing male workers. So here we see that in the second quarter of 2020, during the first MCO, right, this is really during the height of the MCO, there were already immediate and huge differences in how men's and women's employment were affected. So while men experienced a decline in employment year on year of about 0.5% in second quarter of 2020, women's employment fell by 2.5%, right? So that's 5 times higher than male workers. And this is just in the first quarter, right? So in terms of the actual number of workers, about 148,000 women workers either lost or left their jobs, right, on balance. So this trend of women's employment being more heavily affected than men has persisted across the third and the fourth quarters of 2020. And we can see that even as the labor market has recovered slightly from the May 2020 peaks, we saw earlier that employment rate has fallen slightly. And even as male workers proceeded to almost recover to pre-crisis levels of employment in the third and fourth quarters of 2020, women's employment have not really recovered, right? And for the most part, they have been left out of this recovery. So now bringing in the age dimension as well. And this chart shows again the change in employment, and now we're looking at the change in the last 3 quarters of 2020 compared with the same period in 2019. And looking at the age dimension, we can see that overall, in terms of the job impacts across the board, young people have suffered extremely large employment declines, right? Employment declines that are far, far larger, many times larger than the total average for all ages. And these impacts are in stark contrast with older workers. And here we're looking at 35 and above as older and 15 to 34 as younger. So the older workers have actually experienced gains in employment. And looking at both age and gender, we can see that younger women are the hardest hit, right? So younger women have faced a 4.8% decline in employment compared to a 3.2% decline for younger men. And at the other end of the scale, older women have also gained less in terms of employment versus older men. So overall, workers at the intersections of gender and age seem to have fared the worst. And moving on now, looking at the sort of educational and occupational skill dimensions. And let's looking at employment impacts, and we're looking at the chart on the left now, which shows the change in employment by educational attainment. And we can see very clearly that the differences in employment impacts between workers with higher and lower education are glaring, right? So employment losses are overwhelmingly concentrated amongst lesser educated workers, while it's quite the opposite for tertiary educated workers. So employment of non-tertiary educated workers have generally fallen by double digits in some cases. And in the last 3 quarters of 2020, hundreds of thousands of non-tertiary educated workers have lost or left employment, whilst for tertiary workers, we actually see an increase in employment over the same period. And in fact, if you look at the chart on the right, we can see that higher skilled workers have in occupations in higher skilled workers have seen gains in employment amid COVID-19, right? So occupations like managers, technicians, professionals, they've all actually seen gains in employment. Well, if you look at the other end of the scale, occupations like machine operators, elementary occupations, crafts and trades workers, these are all blue collar jobs, right? And they're facing the worst of these employment impacts. And just like with the younger women we saw earlier, now we're looking at the all 4 quarters of 2020. So just like with the employment of younger women we saw earlier, the employment of these lesser educated workers have not recovered. In fact, the employment declines for non-tertiary educated workers, the declines have actually worsened as we go deeper into 2020, right? And even as tertiary educated workers continue to pretty much go the opposite way, right? Continue to see gains. So lesser educated workers, overwhelmingly, like women, have not shared in the partial jobs recovery we've seen since May 2020. Moving on now. Now we're moving away from employment and we're taking a look at the labor force, right? And like in the earlier slide, we know that many Malaysian workers have not only lost their jobs, they have left the labor force entirely. And many of those who have left the labor force tend to be women, right? And so looking at the chart on the left, these labor market exits have set the female labor force participation rate back by about 2 or 3 years. Erasing the gains that over the past few years in trying to get more women into the workforce. And now looking at the chart on the right. So we're separating now further by age and gender, and we can see again these same divergent impacts. Younger people are disproportionately much more likely to have remained outside of the labor force, and older workers in turn doing the opposite, right? Increasingly entering the labor force. And to be honest, I don't know why this is happening. Why older people are entering the workforce? Maybe it's something to do with how retirement is getting harder and harder to fund. But maybe the other speakers have a better idea. But I don't, right? So, but going back to this chart again, this seems to be a common thread. Being young and female seems to be a key vulnerability. Younger women, if you look at the chart, younger women have remained outside of the labor force at far higher rates compared even to younger men. So now we're looking again at occupation and skill, but this is looking at labor force size. So this shows the change in labor force year on year for the last 3 quarters of 2020 versus the same period in 2019. So the same deep divides between workers with different educational attainment are very apparent here again. So this chart illustrates that not only have non-tertiary educated workers faced the greatest employment declines, we saw that earlier, they're also being pushed out of the labor force entirely at higher rates than tertiary educated workers, who continue to enter the labor force. And just as an aside, if you see the total average figure on the far left in the light blue, this shows how much you would miss if you just focus on the aggregate figures, right? If you just looked at that total figure, you would think there's pretty much no change in labor force size. But if you look beyond that, you look at the sort of the constituents of education attainment and gender and age, you will see that actually very stark divides between worker groups. So now this chart is sort of a summary of everything we've looked at in the past 8 slides, right? So the dark blue bars here are the change in jobs, in employment, and the light blue bars are the change in labor force, and stacking them on top of each other can really show you how drastic these divides are. And this is, of course, comparing the last 3 quarters of 2020 with 2019 again. So immediately you can see that the job and labor force impacts have been deeply unequal, separated by gender, education, and age. With the education dimension looking to be at this stage the most glaring disparity, dwarfing even the age and gender dimensions. Nonetheless, it is still important to note, as we've seen earlier, that gender exacerbates these vulnerabilities, right? And in reality, there's substantial overlap between all of these vulnerable groups, with workers at the intersection of multiple vulnerabilities being particularly exposed to shocks. So for instance, the majority of workers in the informal sector are women, and many of them are young and lesser educated, right? So now we're moving from impacts to sort of factors of inequality. So we've seen that vulnerable worker groups, like the youth, like women, like lesser educated workers, suffer disproportionate declines in employment and labor force participation compared to older, more educated men. But why exactly does this happen, right? So it's likely due to a combination of factors. And one factor is that some of these worker groups tend to be concentrated in some of the industries that are hardest hit by the COVID-19 crisis. And for women workers, this tends to somewhat hold true. So if you look at this chart, women tend to be concentrated in industries like textiles and apparel manufacturing, like food and beverage, accommodation, services. All of these industries that are particularly devastated by the pandemic and the movement control order. And the same goes to a lesser extent with lower skilled workers. Okay, lower skilled workers. They also tend to be concentrated in industries like textiles and apparel manufacturing, food and beverage again, wood products and furniture manufacturing, and all these sort of industries that were heavily affected by the pandemic. But even so, these industry mix effects only explain a small portion of the large variations in employment impacts between these vulnerable worker groups and the average worker. Okay, so there must be some other factors, right? There must be other factors. And this leads into other pre-existing and structural inequalities faced by these worker groups, and highlights how women, youth, and less educated workers are worker groups that were already marginalized and disadvantaged and vulnerable before the pandemic, right? And so COVID-19 has just worsened these divides, which is very apparent here. And indeed, looking at labor force survey data reveals that there is a considerable increase in people citing housework or family as a reason for not seeking employment. Okay, so this hints at the role of these long-standing structural factors, and pre-existing inequalities. And international evidence since the start of COVID-19 crisis suggests that the burden of unpaid care and family work on women has been exacerbated by the increasing need for child and family care as schools close, as health risks mount. And I'm sure our other speakers later will illustrate this more clearly. But this increase in unpaid care responsibilities, compounded by the long-standing inequities in the labor market for women, such as the gender pay gap and the systemic discrimination women face in the workplace, have both led to higher job losses for women, as well as higher labor market exits for women. We saw that earlier, right? So this has happened as women, and young women in particular stop working to care for their kids or their families, and very similarly for lesser educated and lower skilled workers, right? They face their own set of issues like difficulties and availability of remote work, and also being left out of social safety nets in cases of non-standard workers. And young workers also face persistent issues of higher unemployment than adults, right? While being in jobs that are traditionally more cyclically sensitive and more precarious, and not to mention the long-term impacts on, especially for younger workers. There's a large body of evidence now that suggests that being unemployed while young, especially for longer periods, have persistent and long-lasting negative effects on the incomes, on the employment prospects, and the mental well-being of young workers. So we're in an unemployment crisis. We know that much. We've seen all the charts. We already know that, right? And we know that it's a deeply unequal one at that. So now I'll talk a bit about potential policy action, right? So overall, my view is that we should focus on investing in improving and expanding our existing social safety net programs to build the resilience of Malaysia's workforce for future crises, right? And to make sure that something of this scale does not happen again in the future, right? While at the same time also looking at short-term initiatives that we can implement right now to alleviate a lot of these hardships. So the first thing I have on this list, just a short one, is to expand the employment insurance systems, unemployment benefits, and active labor market programs. So now I know that there are some good folks from Pekeso in the audience who really know what they're doing. So I would love to hear your opinions about this in the Q&A if you're there. So back to the policy solutions. We need to first increase the EIS job search allowance benefits, and at least temporarily extend the current 6-month maximum duration for receiving these benefits, right? While expanding full EIS coverage to non-standard workers who do not meet the minimum qualifying contributions. As the below left side chart shows, right, more and more Malaysians are remaining unemployed for longer and longer, increasingly beyond this 6 months duration, and even more continue to remain outside of the labor force, so they're not even looking for work yet. So the unemployment insurance system should take this into account and allow employed job seekers or future job seekers who are currently inactive outside the labor force, allow them more time to seek employment before their lifelines and their income support run out. And at the same time, expanding existing active labor market components of the EIS system, including the training allowance, including the training fee, and along with expanding job matching initiatives. I think that these can help Malaysians return to work quicker and help lower skill workers who have been deeply affected reskill and upskill and find employment quicker. And the second thing on the right now is looking at improving our existing cash transfer infrastructure and improving our existing cash transfer programs. So Malaysia's new Bantuan Prihatin Rakyat 2021, which is the successor to the Bantuan Sara Hidup or BRIM back then, has a maximum benefit amount of about 1,800 ringgit annually, and this is for households earning below 2,500 household income per month with 2 kids. So this still only transfers about 9% of pre-transfer consumption estimate. And so there is much more room to go higher in terms of benefit size. So if you see the chart on the right for a comparison with other programs, other cash transfer programs. So we have an opportunity here to increase benefit size, right? Whilst focusing on really reducing program exclusion errors and program undercoverage, which has traditionally been a huge problem in many communities. And for more, you can read my 2019 presentation on the same topic when these slides are available for download later. So the third thing is gender-sensitive fiscal policy. And like we saw earlier, a lot of these gendered employment impacts stem from long-standing structural and systemic inequalities that are inherent in the fabric of Malaysia's social economy, right? And I'm sure our speakers again will delve into that more deeply. But policies that work towards confronting and work towards dismantling these inequalities would be a great help, right? So there's evidence that countries with more equitable and accessible childcare and family leave policies have seen their female workers fare better amid the crisis. So policy solutions need to start with first distributing the burden of care work more equally by subsidizing and expanding childcare investment and enacting publicly funded universal paid family leave policies for both parents, right? Along with things like granting legal protection to women in the workplace. And lastly, expanding infrastructure spending and fiscal stimulus in general would be really beneficial. So overall, we know that we need more fiscal stimulus. Our fiscal stimulus, as it stands right now, is amongst the smallest in the ASEAN region as a percent of GDP, right? And while if you look at infrastructure spending, there's an even smaller, teeny tiny portion of that. If you see the pie chart on the below right, it's very, very, very tiny, 1% of the total size. So increasing spending on infrastructure, along with other fiscal stimulus efforts that we know work. So these are things like a new round of emergency cash transfers, BPN 3.0 maybe. We know that these can raise long-term productivity in terms of the infrastructure and also stimulate economic growth, which tends to benefit marginalized worker groups who have been deeply affected, whose employment is more cyclically sensitive. Okay, this is my last slide. So here's a summary of the entire presentation. If you didn't listen to the entire presentation, just listen to these 4 points alone and that's basically good enough, okay? So the first thing is labor market conditions are bad. The unemployment rate remains near decade highs 1 year after the initial onset of COVID-19. Hundreds of thousands of more Malaysians are unemployed now compared to a year before. And hundreds of thousands more have been pushed completely outside of the labor market. Second key point is that looking beyond these headline figures reveals a huge divide in terms of COVID-19 impacts. So beneath the aggregates, the data shows that the labor market impacts have been deeply unequal, right? So with marginalized workers disproportionately affected whilst being left out of the partial recovery since May 2020, is a typo there, May 2020. And the third key point is that long-standing inequalities have been a driving force. So we've seen earlier that pre-existing inequalities in Malaysia's labour market and society have played a large role in causing these unequal impacts. And policy action, therefore, should focus on building economic resilience for the future and broadening and deepening existing social safety net programs whilst working towards dismantling the structural inequities inherent in Malaysia's society and economy. The last point is this: even if Malaysia's GDP growth recovers to pre-crisis levels within the next year, okay, even if that happens, a full recovery for many affected workers will take years, right? So it may take many years before Malaysian workers in these vulnerable groups return to pre-crisis levels of employment, at least employment to population. So besides that, longer-term consequences, particularly in for young workers and for young women in general, these longer-term consequences will be felt for decades to come, right? So whilst workers in these affected groups will continue to face structural impediments to employment. All right. Yep, that's it from me, folks. Thank you so much for listening. I'm looking forward to the following two presentations by the excellent speakers we have, and I'm also looking forward to the Q&A. Thank you.
Thank you, Calvin, for that insightful and informative presentation. Let's move on to our second speaker, Miss Alicia Farah Jasmine, who is a research analyst at the World Bank Malaysian Hub. She will be looking into the vulnerability of jobs during the pandemic, and she will be delving into the issues of ability of workers to carry out their tasks remotely during the pandemic and other related issues. Miss Alicia, the floor is yours.
Thank you so much, Dr. Juta. Can you hear me? All right, thank you. I'm going to be sharing my screen now. Okay, sorry, give me a second. All right, so hi everyone. I want to say thanks to the organizer of this webinar, ISIS, and many thanks for ISIS for having the World Bank for this webinar. So as introduced by the moderator, I'm Alicia. I'm one of the co-authors of this paper titled The Vulnerability of Jobs to COVID-19, the Case of Malaysia. And we wrote this last October. This has been published in the World Bank website, as well as the ICEA's working paper series, if you're interested to know more about this paper. So in terms of the structure of the presentation, I will be presenting the methodology and findings of the paper, while my colleague Nina will step into the Q&A later on. So just to summarize, what we did in our paper is that we tried to look at the ability to work from home, adjusted for internet access, as well as extent of physical proximity of jobs. And we followed the methodology from Dingle and Neiman, Garote Sanchez, and Monge et al. And so the ability to work from home and physical proximity indicators are actually based on ONET scores for each occupation, and we applied this to the Malaysian data to estimate the extent and distribution of jobs that could be most vulnerable to COVID-19. And with this, we actually analyzed it across a number of socioeconomic variables, such as income, education, gender, urban-rural location, and employment status. And briefly, what we found is that by doing this, we found 64.5% of jobs in Malaysia are not conducive to home-based work, adjusted for internet access, and 50.9% require high levels of physical proximity. And as Calvin has mentioned earlier, workers most vulnerable to COVID-19 are also most vulnerable overall, and this is also a finding that we found in this paper. And one of the recommendations that we make is that further rounds of cash transfers, particularly those targeted to with lower levels of income, might be necessary for as long as the crisis persists. So now I'll be diving deeper into the paper. So I won't spend too much time on this slide. I think everyone is aware of the COVID situation in Malaysia. But yeah, this is the timeline of the daily cases in Malaysia from March last year to March this year. And here we've also plotted the series of control orders, as well as the packages that were announced. So the biggest one, as Calvin mentioned as well, is of course the nationwide movement control order on 18th March last year. And this MCO was essentially a stay-at-home order and meant all economic activities were on a halt, except for a few essential services and natural resources sectors. But when the reductions in daily cases were significantly reduced, the government relaxed these mobility restrictions by introducing a conditional MCO and subsequently a recovery MCO. This meant that some mobility restrictions and physical distancing requirements were still in place. However, as we are also all aware, sizable spikes in the daily cases in the last few months of 2020 and early 2021 have left most states back into the MCO in January this year. Although what's different this time is that under this reimposition of the MCO, more sectors are still allowed to operate. And early last month, some of the states re-entered the CMCO, where interstate travel is still banned, but most economic activities are allowed to operate. So briefly, in response to the crisis, the Malaysian government announced and implemented a series of social protection and employment-related measures to help the population. The first package was the Prihatin package, and it had a central focus on social assistance, while the Penjana package announced in June last year had a greater focus on labor market programs. This year alone, the government has already announced two packages, which is the Permai package, launched during MCO 2.0, and this included some faster rollouts in the one-off cash transfer program, BPN, and some special grants for SMEs. And the Permai Casa package announced recently included one-off cash transfer, cash assistance, an extension of the wage subsidy program, and special incentives for sectors such as the tourism sector. As Calvin has nicely put out just now, several months of mobility restrictions as businesses have severely impacted the labor market and Malaysia's economy overall, and resulted in 17.1% year-on-year drop in GDP in the second quarter of 2020, when the first MCO was still going on. And the slowdown in the economy led to a sharp increase in unemployment, which we can see in the graphs here. So we know from Calvin's presentation that the economic impacts are huge and disproportionately affect the poor and those without standard employment contracts. So according to unofficial government data by the Department of Statistics Malaysia, only some private sectors have lost their jobs during the first MCO, but while close to half of the self-employed respondents lost their jobs, and more than 2/3 of them have savings for only less than a month. The rate of job displacement has also been particularly high in the agriculture sector, which employs a large share of workers from the B4 team. So with this, as long as COVID-19 remains a health risk, businesses and jobs that cannot be performed from home and require high levels of physical proximity or face-to-face interactions are expected to face operational challenges. So our research objective is, what is the extent and distribution of jobs most vulnerable to COVID-19 in Malaysia? So here we would like to estimate the magnitude of jobs that could be impacted due to this pandemic. I will just go into the methodology of how we estimated the numbers. So our study adopted the methodologies from 3 different papers. These are Dinga and Niemann, Garote Sanchez, and Monge et al. And in order to document the extent of jobs most vulnerable to COVID-19, the study relies on 2 indicators of this vulnerability. The first one is the ability to work from home, and secondly, the degree of physical proximity required in a job. And the ability to work from home provides an indication of vulnerability to job loss when mobility restrictions are in place. So for example, when MCO are enacted. While the degree of physical proximity is an indicator of the likelihood that a worker can return to work, given that COVID-19 remains a health risk, even if mobility restrictions are gradually lifted. So as in Garote Sanchez's paper, we also separated the ability to work from home to incorporate whether workers have access to internet or not, and whether they would require internet to perform their tasks from home. So we separate the jobs into jobs that can be performed from home and do not require internet access, and jobs that can be performed from home and need internet access. We then have to identify which workers have access to internet in the first place and which workers lack internet, which reflects their full ability to work from home. And we identify those that require internet access by the importance of email and computer use to their job performance. And we hypothesize that a job is less vulnerable to COVID-19 if it can be performed from home, adjusted for internet access, and requires low levels of physical proximity. In terms of data, we use 2 separate sources for this study. Firstly, our vulnerability indicators, which are the ability to work from home and adjusted for internet, so the importance and frequency of email use, as well as the degree of physical proximity, are data that we have retrieved from the Occupational Information Network from America. So ONET is a free comprehensive online database of worker attributes and job characteristics in the United States. The data gathers information for over 900 occupations, covering the whole US economy. And the way that ONET works is that the survey data are collected directly from workers in targeted occupation at business establishments statistically selected from a random sample. Each worker is required to answer 3 questionnaires, one on general work activities, secondly on work context, and thirdly on knowledge and skills. The database then provides several hundred descriptive ratings based on ONET questionnaire responses. And some of these descriptive ratings we have used in our analysis. And we will dig deeper into this in the next slide. And secondly, we use data from the Department of Statistics Malaysia to gather data for internet access, which is on the district level. We also obtain socioeconomic variables of workers, such as their income, education level, gender, urban-rural location, and employment status, to see how these vulnerability indicators affect different groups of workers differently. So to see the unequal distribution of the impact of COVID on these workers. So more on the ONET indicators. So for those who are unfamiliar, we will elaborate further here. So firstly, on our ability to work from home indicator. This is actually a binary indicator for each job, which the authors Dingle and Niemann has already analyzed in their paper. And they classified occupations into those that can be performed from home and those that cannot, using responses to 2 surveys from ONET. So the first one is work context, and secondly in the generalized work activities. So for example, these are just example questions that they picked up. So if answers to these surveys reveal that, for example, they spent majority of the time wearing common or specialized protective or safety equipment, or working outdoors, and or if they operate vehicles, mechanized devices, or equipment, performing for or working directly with the public, then these occupations is classified as one that cannot be performed from home. And on the internet importance and access, this is directly from Garrote Sanchez's paper, which used 2 specific questions in ONET as well on the importance and frequency of computer and email use in the performance of the task. The answers to these questions are scored on a 5-point scale, with higher numbers indicating greater dependence on computers and email use. Next, on physical proximity. So a job is considered as requiring high physical proximity if the physical proximity required for the job is higher than the average for all jobs. So this is taken directly from the ONET question on work context. To what extent does this job require the worker to perform job tasks in close physical proximity to other people? And we will demonstrate this further in the next slide. So our assumption here is, of course, that these ONET indicators, which are based on surveys conducted in the United States, are applicable in the Malaysian context. In other words, it is assumed that the task content of occupations is identical in Malaysia as it is in the United States. And the assumption of this applicability of the ONET indicators have also been made from the authors, Dingle and Niemann and Garrote, for a broader set of countries. So this is just a slide to show on how they have gathered the scores for physical proximity indicator. So the question posed to workers is that, to what extent does this job require the worker to perform job tasks in close physical proximity to other people? And there are 5 options for the workers to choose from 0 to 100, with increasing proximity as we reach 100. So at 0, the answer is I don't work near other people. For example, fine artists. At 25, they work with others, but not closely. So those with private offices. In the middle, at 50, they work slightly close with others. So those that have shared offices. At 75, they work moderately close with others. And at 100, they work very close to others, near touching, for example, dentists. So what ONET does is that they gather these responses for the workers in each occupation across all 900 occupations. And once we have these scores, we apply it to the Malaysian jobs in groups of workers. And what we found is that 64.5% of jobs in Malaysia are not conducive to home-based work, adjusted for access to internet, and 50.9% require high levels of physical proximity, making them most vulnerable during the COVID-19 crisis. And when we look at the specific sectors and occupations that are more affected than others, here we graph it out. So on the x-axis is the less to more home-based work adjusted to internet access. And on the y, it's the physical proximity indicator. So we expect that sectors and occupations towards the bottom right of this corner of this graph, that is, those that are more conducive to home-based work and require lower levels of physical proximity, to be less vulnerable to COVID-19. And we can see in these graphs is those in professional services and ICT sectors, as well as those that have computer, mathematical, and legal occupations. In contrast, Sectors on the upper left corner of the graph are more vulnerable to COVID-19, such as, here, jobs in physical sales. We also see that, healthcare practitioners and technical are also in the upper left corner of the graph. Of course, they are less vulnerable to job loss due to COVID-19, but they are more vulnerable to the health risk of COVID-19. So if I could summarize, jobs that are not conducive to home-based work and jobs that require higher levels of physical proximity are vulnerable in different ways. Jobs that are not conducive to home-based work are most vulnerable when mobility restrictions are in place, like during MCO, and become less vulnerable when MCOs are lifted. Jobs that require high levels of physical proximity are vulnerable for as long as the health risk persists. And this is why it's important to, make sure that the vaccination program gets rolled out as soon as possible. It is also important to note that these estimations are made using information on the jobs prior to the crisis. And in the course of last year, we have seen many jobs transform. For example, education and training have largely moved to a virtual or hybrid format that we can expect to require lower levels of physical proximity, and that is not reflected in this graph. And when we look at the states and variability of states, we find that less developed states are more affected by mobility restrictions. And this is perhaps due to the states having more jobs that are less conducive to home-based work and requiring higher levels of physical proximity. And the relationship between GDP per capita and the share of jobs that are not conducive to home-based work, as well as involving high levels of physical proximity, are more than negative 0.6. So just an example, in Putrajaya, only 29.3% of jobs cannot be performed from home, compared to 78.1% of jobs in Kedah. And when we look, when it comes to income and education levels, data also shows that jobs of workers with relatively lower levels of income and education are most vulnerable to COVID-19, which is what Calvin has found earlier as well. And we find that this is because it's largely due to the inability to work from home. So in both of these figures, we observe a large difference in the ability to work from home, which is the light blue line, between the lowest and highest income deciles, as well as between those with no certificate and those with tertiary education. So the unequal distribution of jobs that can be performed from home skewed in favor of those who are better off, particularly those with higher levels of education, is actually not a unique finding in Malaysia. It's also been found in a number of countries, including in Europe, Brazil, India, Mexico, and Turkey. Turning now to by employment status and age, the graph on the left shows that own account workers and unpaid family workers are relatively more likely to have jobs that are not conducive to home-based work and require high levels of physical proximity, making them more vulnerable compared to, employers and employees. And the finding on age group on the right-hand side is in line with what Calvin has mentioned earlier as well on the impact of the unemployment on youth. So the graph on the right shows that the jobs of the youngest and oldest workers are relatively more vulnerable to COVID, in particular with regard to the ability to work from home, which is again the light blue line, with the U-shaped curve indicating that the youngest and the oldest are less likely to be able to work from home. When it comes to location and gender,
Sorry, Ms. Elisha, can you start wrapping your presentation up, please?
Oh, okay. I still have quite a few slides, but okay. Yeah, in terms of for location and gender, we find that workers from rural areas and men are more likely to have jobs that cannot be performed from home and are therefore somewhat more vulnerable to COVID-19, there are little differences in physical proximity requirements between between location and gender. 80% of workers in rural areas have jobs that are not conducive to home-based work, compared to 60% of workers in rural areas, as you can see on the left-hand side. 70.5% of male workers have jobs that are not conducive to home-based work in gender, compared to 53.2% of female workers. So that said, even though workers from rural areas and men seem generally more likely to have jobs that are vulnerable to COVID-19 due to the inability to work from home, it is also worthwhile to note that in Malaysia, workers from rural areas and women are on average relatively more economically vulnerable, as highlighted by Calvin. So although this shows that they may perhaps be able to work from home, this also comes with the increased double burden of care work and work at home. As further analysis, we have also tried to map out skills and the ability skills in occupations and the ability to work from home. And looking at the skills content of occupations is important due to the changes of the nature of work resulting from technological change and automation. So these were already trends that we've seen before COVID-19, and the crisis will only accelerate the automation process. So this suggests that even as countries gradually recover from the crisis, the demand for skills that are less likely to be automated may increase more rapidly. And with this, we follow closely to what Asimoglu and Autor has done in their paper. And similar to before, they have used the ONET indicators to classify occupation in 5 different types of skills. The first one is non-routine cognitive analytical skills. Those are usually people in managerial, professional, and technical professions. Non-routine cognitive interpersonal skills are those that have worker attributes such as establishing and maintaining personal relationships, guiding and directing subordinates, and coaching others. Non-routine manual physical skills are those usually in service occupations. Routine cognitive skills are those in clerical, administrative, and sales occupations. And lastly, routine manual skills are those usually with production and operative occupations with worker attributes such as controlling machines and processes and spending a lot of time making repetitive motions. So it is hypothesized that jobs that can be performed from home are relatively more likely to require non-routine cognitive analytical and interpersonal skills and routine cognitive skills. So what we've done is, again, we use this approach and apply it to Malaysian data. And what we found is that jobs that require higher degrees of non-routine cognitive analytical skills and non-routine interpersonal skills is positively related to the ability to work from home indicator. So this means that increased home-based work would likely further increase the demand for non-routine cognitive, analytical, and interpersonal skills. These, again, were already trends that we have seen before the COVID-19 crisis. So I think, I'll just wrap up now. So to conclude, we found that workers most vulnerable to COVID-19 are also most vulnerable overall, and they include low-income earners, workers with relatively low levels of educational attainment, own account and unpaid family workers, as well as workers from rural areas. And these kinds of workers also tend to have informal jobs, unprotected by the formal social insurance. And so any, social insurance programs that are supposed to help workers will not benefit them. So with this, further rounds of cash transfers targeted at B40 may be necessary as long as the crisis persists. And lastly, there is also an increased and urgent need for skills building programs that can enhance workers' non-routine cognitive analytical skills, as well as non-routine interpersonal skills, so that they are less vulnerable to COVID-19. And with that, I end my presentation. Thank you so much.
Thank you, Ms. Elisha, for sharing with us your empirical analysis, and it is very insightful indeed. And hopefully the policymakers are in this group so that they can tweak their policies in the near future to cater to the impacts of the pandemic on these vulnerable groups. Our third speaker would be is Dr. Grace Lee Hui Yen. She is an associate professor of economics and head of the Department of Economics with Monash University, Malaysia. She is currently leading a team of researchers from Australia, Indonesia, Malaysia, and also Thailand on a regional project entitled Women Entrepreneurs, Rural Women Empowerment through Entrepreneurship in Malaysia, Indonesia, and Thailand. Welcome, Dr. Grace. The floor is yours. You are on mute, ma'am. Yes, go ahead.
Yes. Okay, thank you so much for the introduction. Can you all hear me well?
Yes, loud and clear.
Yeah. Hi, good morning, everyone. And first of all, I'd like to thank ISIS for having me here as one of the speakers. And I'm very glad that Kelvin sets the stage by presenting the hard facts and figures of how women were harder hit by men by this pandemic. And here I'm going to shed some lights on some of the potential reasons behind this trend. Women have suffered the worst impacts of COVID, not only on the front lines of healthcare, but also through an alarming spike in domestic violence, the unpaid care burden, disproportionate economic impacts of the pandemic on women as a result of women losing jobs, earning less, subsequently saving less and holding less secure jobs, and more often being employed in the informal sector. According to the UN Women, all these factors are going to push 47 million additional women into extreme poverty. Women may be at risk of greater exposure to COVID-19 because of the occupational gender segregation. Well, in Malaysia, women make up 97% of all nurses, meaning that more women are at risk as a result of their profession. As the governments around the world have implemented critical measures to control the spread of COVID-19 virus and keep the community safe, there have been many alarming reports of increased violence against women and children who are isolated at home with their abusers. One of my PhD students, Ishtiaq, he conducted a field experiment, randomized control trial in rural Bangladesh in December 2019. He's very lucky. We completed the study right before COVID. And we used this survey question. So this was one of the survey questions that he used in line with what the other researchers used to measure the degree of domestic violence faced by households. So we asked this question: do you think beating by husband is justified in the following events? If she burned food, neglect children, argued with husband, going outside without permission. Well, our sample size was 200 wives and 200 husbands. okay? And about 1/3 of the husband actually said yes, beating by husband is justified. And if you look at the figure by the wife, almost the same percentage of wife who thinks that beating by the husband is actually justified if they did all those things. Okay, so well, in Malaysia, as soon as the MCO came into effect last year, the Women's Aid Organization has seen an increase of 44% in hotline calls and WhatsApp inquiries in the first 2 months in February and March. And subsequently, they observe an even greater spike in the following month. I'm going to shed some light on the gender role attitudes, and in fact, gender inequality is deeply rooted in the traditional cultural norms. Traditional cultural norms and gender stereotypes collectively work to link women to family roles, whereby the society expects women to concentrate on household work or engage in traditional feminine occupations and master associated skills. Men are expected to support their families economically and improve upon their abilities to access the market resources. So therefore, cultural gender values are prominent forces, resulting in the different investments in human capital, differences in capacity, and an income gap between men and women. Okay, I'm the principal investigator of the World Values Survey in Malaysia. And we conducted the latest wave of Wave 7 of a survey, nationwide survey. We completed in 2018 with a sample size of 1,300. And we asked the respondents, being a housewife is just as fulfilling as working for pay. And we asked them if they strongly agree, disagree, or strongly disagree with this statement. Okay, over here should be strongly disagree. Okay, so you can see that men and women equally agree. Majority of the men and women in the country agree that being a housewife is just as fulfilling as working for pay. Another gender role attitude question that's commonly used by researchers is, when jobs are scarce, men should have more right to a job than women. So we asked this question. Over 50% of men agree with this statement that they have more right to a job than women when jobs are scarce. So we saw about 15% of women actually strongly agree with this statement. Okay, and 23% agree with the statement. So we can actually see that the gender role attitudes are also deeply rooted in the Malaysian society. Well, Calvin has mentioned this just now. I'm just going to shed more light on this disproportionate burden of unpaid care and domestic work falls on women. So it is not surprising that as a result of the lockdown and the spread of the virus, women are substantially more likely to perform the household chores and watching the children, caring for the elderly and the sick. In a rapid assessment survey carried out by the UN in a few countries in the region, including Bangladesh, Cambodia, Nepal, Pakistan, the Philippines, and Thailand, cleaning, cooking, and serving meals appear to almost exclusively women's responsibilities in all the countries that they surveyed. A 2019 study by Khazanah Research Institute found that Malaysian women surveyed were shouldering a double burden, where they spend nearly 64% more time than men on unpaid care work, despite working almost the same number of hours as men in paid employment. So this increase in unpaid labor has already reduced women's contribution to the economy. Of course, those activities are not part of the GDP. So if this extra burden lasts, it's going to cause more women to leave the labor market permanently. So it is going to reverse the progress towards gender equality and stunting economic growth. COVID-19 has increased the unequal burden of care carried by women, causing more women than men to leave the labor force during the pandemic. So we actually saw the figures presented by Calvin just now. While some women may choose to leave the workforce temporarily due to COVID-19 with the intention of returning after the pandemic, research actually shows that career breaks have long-term impacts on women's labor market prospects, and the women will return to lower pay and lower skilled positions. In Malaysia, about 1/4 of working women fall under the category of vulnerable employment, where they are either self-employed, informal workers, or unpaid family workers. So these women lack the security of those employed in the formal sector and heavily susceptible to partial or total income loss during the pandemic. The UNDP data actually reveals that out of the 225 COVID-19 task force up and running across 100 over countries, only 24% of members, the task force members, were women. So women have been on the front lines of the COVID-19 response. However, they have been systematically excluded from decision-making processes on how to address this impact of the pandemic. So at the moment, men have been given themselves the impossible task of making the right decisions about women without the benefits of women's insights. So in addition to Calvin's presentation on policy action, I think it should be included in the policy that we need women in the decision-making process. It is important to ensure that women's equal representation in all COVID-19 response planning and decision-making. So in other words, for an effective COVID-19 response, policies and programs must include a gender lens. So it is clear that any pre-existing gender inequalities will now be worsened by the pandemic. And this is what I'm going to present next: entrepreneurship, women entrepreneurship. Well, entrepreneurship is known to be a key mechanism to redress this inequality and the associated impediments to inclusive and sustainable development. Rural entrepreneurship can be a promising source of income to eradicate rural poverty. However, globally, women are less likely than men to become entrepreneurs. And the lack of entrepreneurial skills has been identified as one of the important obstacles for the potential entrepreneurs, and often access to training on such skill is difficult in developing and the least developing economies. When we conducted the World Value Survey in 2018, we actually added some questions on entrepreneurship, and we asked women who would like to be entrepreneur, but they did not think it's feasible for them to be self-employed within the next 5 years, although there's preference for them to become an entrepreneur. And we identified the three main reasons for this. So having insufficient capital is the main reason. Having not enough skills, the second reason. No business idea as well. Okay. With this, I'm collaborating with Amanah Ikhtiar Malaysia, the country's largest microfinance provider. They supplied microloans to over 400,000 B40 women in the country. And yeah, an MOU with them will be signed in less than 2 weeks' time. We're aiming to develop business training programs aiming at the rural communities. Monash, Malaysia, we have an EI hub, an entrepreneurship and innovative hub, which can help with this exercise as well. And we're going to provide in-house training. We'll work with Amanah Itia Malaysia to design the training program to train the trainers at Amanah Itia. So all these programs, training programs, we're going to measure the effectiveness and to increase women's micro entrepreneurs' participation in the e-commerce marketplace. In fact, this is the most urgent need right now among the women micro entrepreneurs. With social distancing, it is important for them to market their products in the e-commerce platform. So training programs have been rolled out nationwide for them to participate. Together with my colleagues in Monash, Australia, who are experimental economists, we actually aim to design external mechanisms to incentivize this effort. Well, please allow me some commercial time. I'm recruiting PhD students. We offer Monash PhD scholarship for all citizens of ASEAN who are interested in pursuing your PhD. So you're welcome to write to me if you are keen to find out more. Okay, and I look forward to your questions, and that's all. Thank you.
Thank you so much, Dr. Grace, for that, for sharing with us your micro level data from the collection, from the collected survey questions and answers. We look forward to a more elaboration on your part during the Q&A session on your presentation.
Sure.
And our fourth expert is actually Dr. Amanina Abdurrahman. She's an economist in the Social Protection and Jobs Global Practice at the World Bank. She works in social protection skills and also in jobs and labor markets and migration, focusing on Malaysia. She will be joining us in our discussion in the Q&A session. So without further ado, let me pass the floor to my colleague, Mr. Haris Zaino, who already has a few questions in place from the audience. And again, please feel free to raise your hands so that this is more of an interactive session and not a robotic one with everyone typing away on the screen. Okay, the floor is yours, Haris.
Thanks, Jutta. Thanks for all the speakers and the insightful presentations. I think there was someone who raised his hand earlier, but he might have put it down. I think because it was like 20 minutes ago. Anyway, so we'll just go to the Q&A box. There's a question here to Elisa. What are some concrete policy recommendations that countries can take to meet the challenges of the acceleration in automation and the change in skill demands towards higher skilled workers? Elisa, and other speakers, if you feel you have something to chip in, please feel free. Thank you.
Okay, thank you for the question. I'll just start and maybe my colleague Nina will also chip in after. So in terms of the policy recommendations, I think it's important to have skills building program that actually complements the automation. So these are skills such as non-routine cognitive analytical and interpersonal skills that I have mentioned in my presentation earlier. So these are skills that are found to be complements to the automation process. So I would think that courses and on-the-job training would help workers for this. But yeah, maybe Nina can add on.
Thank you, Alicia, and thank you for the question. Yeah, so just to add on to what Alicia said, which is exactly on point. I think there's really no shortcut to this. People need to build the skills to be able to be employed in this more high skilled jobs. And I think there are maybe a few things that a country can do in conjunction with this skills training. And one of it was suggested by Kelvin earlier, actually, which is to give people longer time to search for jobs, in terms of maybe having a longer term for unemployment insurance, and in that sense, during that time, they will be able to build their skills toward obtaining a more high skilled job that is also kind of more resilient to crises, so to speak. Other than that, I think for youth, particularly in other countries, we've seen evidence that apprenticeships are incredibly important for them to be able to attain jobs in the longer term, and especially now in the period where we are recovering from the crisis. And the reason for this is because it's incredibly difficult to get a job without having experience beforehand. But then again, how is a student graduating from school expected to have any sort of job experience? And so apprenticeships are kind of one way for young people to develop their skills and eventually also obtain higher skilled jobs. So I'll stop there. Thank you.
Thank you. So I was reading another question. We have a question here on whether the studies conducted directly or indirectly identify structural impediments inherent in Malaysia's economy that will exacerbate our ability to recover within the next 2 to 3 years. The person who posed the question also says that this is critical due to the direct correlation in job creation activities. Does anyone take this question? It was not posed to any speaker specifically.
So maybe I can. So Kelvin, you want to go ahead?
No, please go ahead.
Yeah, maybe I can start, and other speakers may have thoughts. So in this particular study, we did not look into the structural challenges that Malaysia faces, but in another World Bank report, and over here I'll make a pitch. A recently launched World Bank report is called Aiming High, that looks at all of the challenges that Malaysia faces as it transitions into a high-income economy. And indeed, in that report, we explore kind of a broader range of issues, including the need to enhance competitiveness in the country, the need to strengthen governance, and today we've talked a lot about the supply of labor, right? So we're talking about the people who are in the labor force, we're talking about skills building, but one thing that we haven't talked about is the demand for labor. And so that is kind of the other aspect. And one of the ways to do that is really to attract investment that can create jobs, high-skilled jobs for Malaysians. And so for those who are interested, I would point you to that direction. The report is very comprehensive and talks about a broader range of issues. Thanks.
Anyone else want to take a go at the question? Dr. Grace, Kelvin, maybe?
No, I actually just want to say that about the same thing about the Aiming High report. That's pretty much the focus of that. But in terms of structural impediments, I don't think we focused that much on that, but I did focus on the structural inequalities that women and youth and less educated workers face, and I think that there's sort of another impediment to recovery in that front in the labor market and for workers.
Right, thanks, Kel. Zainab Ali had posed a question saying that related to Kelvin's point on improving cash transfer and social assistance program, she thinks that it's also important to shift the direction away from one-off unconditional cash transfers in Malaysia. What do you think about incorporating behavioral design and linking cash transfers to awareness or nudging towards savings, better nutrition, care, etc.?
I can take
Kelvin,
this
do you want to take
question.
that first?
Yeah, thank you. Thank you for
yes,
the
please.
question. Yeah, Zainab, I think you have asked the right question. In Malaysia, I think Monash Malaysia is probably the only university that has started behavioral economics, behavioral studies, because our colleagues in Monash Australia has one of the best teams of experimental economists in the world, and I'm collaborating with them, and we started like 5 years ago. And in fact, before the GE 14, I had a plan with On Kian Ming. At that time, he was in charge of the Penang Institute, and we did have a plan. They were planning to issue a card for Penangai, and we're planning to look into the cash transfer, the social programs, using nudging and other behavioral designs. But then after that, GE14 came, Pakatan won, and yeah. So I have not given up actually, but it's just that academicians and at the public universities. I think some of the universities have started looking into behavioral studies. And one of my PhD students actually looked into nudging students to walk more. Yeah, certainly, nudging people to take better care, healthcare, better nutritional food, and so on would be very, very important, I think. So, yeah. I really hope that our policymakers are very keen to take this up in the near future, because Singapore, for instance, they have started this nudging program many, many years ago, looking into, for instance, how to nudge people to take public transport during peak hours. Yeah, and also saving. Let me just share a very interesting study published in the Top Economics Journal. In America, they found that the poor, they do not save, okay? Because precautionary saving is definitely very important for the poor. They don't save, but they actually spend a lot of money on lottery. So this experimental study actually found that if they nudge the poor to save by telling them that, if you save a certain amount of money and that gives you a chance to win something, and that actually increased the saving rate significantly among the poor. Yeah, so the intervention can be very costless and effective.
Thank you, Dr. Grace. Kelvin, Alyssa,
Yeah,
do you have
so
anything to add to that?
if I could add to that, because I've done some research on cash transfers in the past. So yeah, thanks, Zainab. Good to see you again. I think that moving away from one-off cash transfers, yes, that's a great thing. But moving away from unconditional cash transfers, I'm not really in favor of that. So I think that for one-off cash transfers, there is an opportunity here to formalize that, consolidate that into flagship programs like BSH or BPR, and make that one-off components more automatic, right? So responding to economic conditions. So when unemployment rises, if there's a spike in employment conditions and if there's a spike in unemployment or deterioration in conditions, then these one-off emergency support cash measures can go on top of the original BPH or BPR or BSH amount and be a supplementary income in that way. But in terms of making it conditional on behavioral sort of education or health, I'm not really super in favor of that. Conditional cash transfers, I think the research has shown that it's cheaper, less administrative cost to governments, less paternalistic to recipients, and it's greater poverty and inequality impacts because of that. But I think there is an opportunity here to use behavioral design, use nudging, but not tie that to the receipt of these cash transfers. There are other ways to nudge other than using cash transfers as a carrot, so to speak, because like I said, it really undermines the inequality and poverty impacts in my view.
Thanks, Kelvin. Does anyone have a response to that, or does Alyssa or Dr. Manina want to add anything to the question? If not, then go ahead, please.
Yeah, maybe I can just quickly jump in and to jump on Kelvin's point of making these cash transfers unconditional, and I think I personally also am in favor of that. And perhaps what Zainab was indicating, although I don't know, well, Zainab from the World Bank, so she can probably check in with me later. But rather than making them conditional, I think kind of sharing the information to cash transfer recipients. So I think that's something that's been found to have positive impact in other countries as well, right? So it's kind of like, okay, here's your cash transfer. Oh, by the way, did you know that certain types of vegetables have this kind of nutrition for your children, or something like that. So
Mm.
it's not about making them conditional, but rather about providing the right types of information to people that maybe will maybe lead them to think about what to do with the cash transfers. Yeah, thank you.
Thanks. Thank you. All right. Let's see. What else do we have? Some question. There's a question here about the problems and all quite clear, but the biggest issue that we always face as a country is about implementation. I think this speaks to having good ideas, but when it comes to implementation, then perhaps that's lacking. The person who posed the question did not specify any single policy per se, but does anyone have any thoughts on how to implement, how to overcome any kind of like implementation challenges with regards to any kind of policies that you've mentioned in your presentation or the ones that you're proposing? The moderator's biggest fear, you look at me, I look at you kind of thing. Okay, let's give it like a few seconds. Does anyone want to have a swing at this? If not, we can always move on to another question. That's fine as well.
Don't really have anything to add on implementation other than I guess program monitoring and evaluation is key, and something that we're lacking across the board in all of our economic policies. So I don't know if Alicia and Nina has anything to add.
Well, I mean, I guess the reason we are always talking about policies is because we're thinking about it from the policy perspective, and we're not exactly implementers. And so if we, I think there was a webinar a few weeks ago held by the World Bank, and there was another panelist. So don't quote me on this, but there was another panelist who kind of just said the only way to be able to implement that is to just do it. So I guess at the end of the day, it comes to that and a little bit of political will, which us as kind of researchers don't have that kind of ability to do. Thanks.
Sure, fair enough. Dr. Grace, I mean, this is not a Q&A, but earlier in your presentation, you had mentioned the statistics about the increase in violence towards women during the pandemic, right? And that's a real big problem. But from a policy perspective, right, do you think there's been enough like novel policies that's been introduced during the pandemic to counter the problem? And what do you think could be done to address this like really, really big issue in our society?
I think there should be a safe place where the women could feel safe to report their perpetrators. Yeah, and then it could be what was done in other countries was that they set up these centers at, let's say, shopping malls shopping malls where women usually visited, so that let's say their abusers wouldn't suspect that they have gone somewhere to report them. So in other words, I think more shelters as well, online responses. I think somewhere that's easy for the women to report and also to feel safe.
Thank you. Just to build a bit on that, right? I remember you had a slide that showed the responses to the question, do you think beating by husband is justified in the following events, right? Burn food, neglect children, all that. The husband beat 32%. I mean, that's really bad. But what I found personally really surprising was that 29% of wives said yes as well. So, they feel like it's justified, right? And I think this really speaks to perhaps societal norms and gender roles and gender violence in Malaysia. Yeah. So do you have anything in mind about how do we, effect a kind of change to this more like systemic issue?
No, this was actually done in rural Bangladesh and not in Malaysia. We do not know. Yeah, well, we could conduct the same survey in Malaysia, but in Malaysia, I think the figure would be a lot lesser. I hope.
We hope.
Yeah.
All right. Okay. Cool. There's a question to Kelvin from Zairina Zainuddin from Bernama. On the suggestion for extension of unemployment benefits, any time frame proposal for this? As MOF and BNM has said that has said that employment has started showing recovery, and how will this suggestion give impact to the country in terms of the short term?
Right. That's a good question. So I think the suggestion of extension for unemployment benefits, and this is specifically the job search allowance under the EIS component, I think there is no set time frame for how long we should extend it to. We should extend it to like potentially until employment recovers to to normal, right? So it could be 3 months, it could be 6 months. So basically, we temporarily extend the receipt of these benefits unconditionally until some sort of recovery is we can really see the recovery that's really obvious. And I think around in this time frame, we also need to shift temporarily as we extend this unemployment benefits. We need to temporarily shift the funding of these EIS benefits to the government on government budget, right? So currently EIS is funded by payroll taxes on by workers in general, and extending, I think these benefits would be a huge cost on the pool of contributions. So I think immediately shifting temporarily the funding of this extension to the federal government, and also making it essentially an open-ended thing, like it will be extended until maybe unemployment reaches 4%, or maybe when the employment to population ratio increases to what was before the crisis. So I think that's the answer to that.
Yeah, and that I would like to also add that although the official figures show that our unemployment rate is now getting better, the sign of recovery, but please bear in mind that the official figures may not be truly representative of the actual condition of the economy. For instance, it doesn't differentiate between part-time, full-time worker, and let's say a highly educated worker actually took up a low-skilled job, so that he or she could earn some money during this pandemic. So this is actually not reflected in the official unemployment rate. So what we saw, we may think that, oh, it's recovering and all that, but we call them actually underemployment. These workers could have done more and they wanted better jobs, but they may actually end up taking up low skills jobs, or they wanted to work full time, but the only jobs available were part time. So all these were not captured by the official unemployment rate.
Yeah, I think that's an excellent point by Dr. Grace. And if you look at measures of skill based underemployment and time based unemployment, they have both increased. And those wouldn't show up in the employment statistics.
Yep.
Yeah. So this also shows the dangers of just looking at the aggregates, right? Underneath the aggregates, there's a lot more going on.
Kelvin, there's also a question that you posted during your presentation just now about you're wondering why the older workers saw an increase in employment rate. In fact, we during recession, we observed what we call an added worker effect. So for instance, the breadwinner of the family lost a job, and as a result, the wife who used to be a housewife started looking for a job. Okay, but of course, the housewife who were not in the employment for, let's say, years would be less likely to get a job, so they will be unemployed. And whereas, let's say, the father or the grandfather who was supposed to retire and they now look for a job, men, if they have better education and more experience, they're more likely to get a job. So they could potentially be the added worker in the labor force. Yeah.
Thanks for that. Makes a lot of sense.
All right, I think we're close to running out of time. So let's just end with the last question in the Q&A box, right? How do we ensure policy actors, government, other policymakers actually listen to the data and respond effectively? The person again did not identify any single speaker to pose this question to, but those who are comfortable with taking this on, how to ensure the policies that everyone's recommended here, actually gets listened to and the data gets listened to, and how do they respond effectively? Those who are comfortable, you may have a go.
Maybe I can start.
Yes,
And I will probably share an experience not during the COVID pandemic, but an experience that the World Bank had a couple of years ago. So we published a report on women's economic opportunities, So in that particular report, we highlighted the challenges that women face in participating in the labor market. And I think that was just a good year for that topic because various other think tanks, including KRI, also published a report on the women's care burden. And so at that point in time, I think there were various think tanks, various voices, all kind of putting out the same message at the same time. And so an issue that was already known, I mean, low female labor force participation rate is not a new issue. It's not something that that policymakers don't know about. And in that particular year, it gained a lot of traction. At that point in time, I think even even in the budget, then there were more measures that were geared towards boosting female labor force participation, including strengthening childcare. And so in that sense, I guess what I'm trying to say is that yes, the data is there, yes, policymakers know about it, but I think the more compelling we can make an issue is with more and more voices kind of saying the same thing and continuously adding to the evidence makes a difference. And in our case, what we did was, other than just looking at the numbers and saying, hey, the female labor force participation rate is low, what we also did was we conducted qualitative research, and we conducted focus group discussions. And so we had quotes basically from women saying why they didn't participate in the labor market. And at the same time, we also did kind of a legal analysis of the challenges that women face in terms of participating in the labor market. Thank you.
Thank you. Kelvin, Dr. Grace? No. Kelvin, I see he's taken off his glasses. Does that signal no? He doesn't even want to look at me anymore. All right, cool. Thanks for that, Dr. Manina. I think with that, let me just pass the floor back to Dr. Juwita and let's see how she wraps up the session. Thank you, everyone.
Thank you so much, everyone, for that very interactive and insightful session. Since we have a bit of time left, let me give each speaker about 2 minutes to give their last messages to the audience and also the policymakers on how to make things better. Can we start with Kelvin?
Yeah, I don't really. Okay. I guess the main message is that, yeah, like the headline labor market indicators in itself are. I got muted.
Yes.
Sorry. Yeah. So I think the main message is that the headline figures are already pretty bad. But if you look beyond that, it gets worse, right? Especially for certain worker groups, and I think this whole session has really encapsulated that pretty well. And therefore, policy solutions need to be really cognizant of this, and not just look at the headline figures and really forest for the trees, right? So we really need to focus deep on these specific worker groups, and the recovery in labor markets will be dependent on the recovery for these workers.
Thank you, Kel. Elisha, any last words?
Yeah, on top of what Calvin has mentioned, I think it's important to have targeted policies to these group of workers to make sure that they are more resilient to the COVID-19 impact. So things like skills building program to make sure that they have skills that are complementary to automation, for example, that a trend that is accelerated by COVID-19. So yeah, policy needs to be targeted, I think. Yeah, that would be my last message. Thank you.
Thank you. And Dr. Grace?
Yeah, policymakers, I'm not sure in the country, all these policies on COVID responses and what is the percentage of women that's involved in these decision-making processes? Because if not, they wouldn't understand the women's point of view. For instance, in a study, in a survey that I mentioned just now, carried out in a few Asian countries, they found that the women's responsibilities were actually more time-consuming tasks, cooking, unpaid childcare, caring for other family members that are ill. This was found in a survey. Men's main task, grocery shopping and playing with children. Actually playing with children. They were less time consuming. So, and also coupled with all the extra, let's say, exposure to domestic violence and so on, I think, without enough women in the decision-making processes, many things are going to be overlooked. So to have more gender-responsive policies, we certainly need more women to be involved. Yeah.
Thank you
That's
so
the
much.
main message. Yeah.
That is a very important message to be put across there. And last but not least, Dr. Amanina, the floor is yours.
Thank you. Thank you, Dr. Jurita. So I guess for my last message, I would like to say that responses to COVID don't just have to be responses to COVID, and it's actually an opportunity to make investments into kind of longer term changes. For example, in terms of active labor market policies, and Kelvin mentioned some of these, and as Malaysia develops, people become more wealthy. We want more, right, from our government, and strengthening the active labor market policies would be good now in the time of recovery from the crisis, but it will also serve a longer term purpose for the economy of being more resilient in the future. Thank you.
Thank you so much, everyone. That was really a very rich discussion, food for thought before our lunchtime. Please join me to thank all of the speakers today, and we hope to be able to have such a rich discussion again in the near future. So good luck and all the best, and stay safe. Goodbye, everybody.